Well, hi everyone. I'm Carole Freeman of Hypnotic Nutrition. I'm the creator of the 90-Day Keto Diet Program. I'm here today with Dr. Paula Wrentmore.
That's right.
Did I say it correctly?
You
All right.
did.
She is a chiropractor and also a keto follower. And so I invited her to chat with us here and share her business profession, how she got into what she's doing and all that. So tell us, who are you? How do you identify yourself?
Wow. I'm very multi-passionate. I've done lots of things in my past lives. So the one theme that I see that kind of surrounds all the things that I do is potential, like human potential. Like, who are we really inside, and does the outside match what we are on the inside?
Okay.
And if it doesn't, which do you like better? What you want on the outside, or what you feel on the inside but maybe hasn't expressed itself on the outside yet?
Okay.
So my job is, as a chiropractor, is to, no pun intended, but really to bring you into alignment with who you are, okay? So that means getting your spine in the right place, stacked up so your posture is really good, so that all the joints of your body are functioning properly, because if your joints aren't functioning, you're not going to be moving very well.
Right.
That is the key to movement, is having functional joints.
Yeah.
And that's really how I approach health, is very functionally.
Okay.
Not so much static, like what do you look like? Because you can have a picture perfect appearance, but if things aren't working properly, it doesn't really do much good.
Yeah. Well, so I'm curious, you're from Texas, Austin. Did you grow up there, or?
No, that was where we lived for the last 10 years before we moved here.
Okay.
But I grew up,
and here is the Seattle area.
Yeah. But I grew up in California, near the San Francisco Bay Area.
Oh, beautiful.
Yeah. And I went to school there in the Bay Area. Went to San Francisco State University, and I went to Life Chiropractic College West.
Okay.
It was in San Lorenzo. Now they have a humongous, amazing, beautiful facility in Hayward, which I graduated too soon for that, but I did contribute.
So what led you, though, to go to chiropractic school?
Gosh, can I say I heard a voice in my head?
Okay, yeah.
I did.
Sure.
I heard a voice in my head. I was a massage therapist before I was a chiropractor for, maybe 10 years before I went to chiropractic school. I was doing massage therapy.
So you're very in touch with the body and helping it feel good and work right then.
Absolutely. Yeah. And culturally, too, I grew up in a predominantly Korean household, and I grew up giving my mom and my dad massages.
Okay.
As I got older, there was a little bit of payment involved in this, like a quarter, $1 by the time I was 12, to get us to do this. So
you had lifelong training then.
Yeah. I grew up doing it. It was, destiny, I guess. So I grew up with an idea of natural healing, and my mom would always be brewing, all these tinctures and tonics and things in the kitchen, like Chinese herbs that would smell out your whole house. Like, friends would come over and go, "What is that?"
Did she make homemade kimchi too?
She did.
I've heard that's quite pungent smelling. I had some friends at Bastyr that would talk about she just always wanted to make a batch, but her boyfriend made her keep it out on the back porch because it was
Smart man. Yeah. My mother always had 2 refrigerators, one on the back porch and one in the kitchen. And the back porch was the kimchi refrigerator.
Okay.
It's very pungent, but it's fermented cabbage, kind of like sauerkraut, but with garlic and pepper.
Tastier, spicy.
Well, I'm a little biased. I think it's very tasty, and it's really good for your gut.
Yeah.
And it kind of populates your gut flora again for you. So I'm always amazed when people who are not Korean enjoy kimchi, because I grew up, I was probably the only Korean within a 100-mile radius.
Oh, okay.
So it was kind of like really exotic and foreign to everybody.
Yeah, well, going to Bastyr, we get a lot of training about how to make our own different ferments, and so we learned to make sauerkraut and kimchi and some other different cultural things too.
That
and
is
so,
awesome.
yeah, I can appreciate it more than probably the average person in the United States. But I understand the benefits of it, but I also like spicy food, and so
yeah. Well, what really surprised me is that Korean food is now kind of like a very popular food. You see, even in Austin, there were food trucks. I don't know if you guys have food trucks.
We have a few. Portland is a lot bigger market for that, but
Austin's a big food truck kind of place, and there was Korean Mexican fusion.
Oh
my God, it's so good! And a few years before I discovered this, my husband and I, who were both kind of amateur foodies.
Okay.
But he said, wouldn't it be great if we took like Tex-Mex, Korean, put them together and got a food truck?
And then you found one.
And then we found one. It's like, someone's already doing our dream. See, you gotta jump on it when you think it. Yeah.
Oh, okay. So you grew up with probably a very healthy diet then, right?
Yeah, definitely.
Yeah, and so I'm going to go back to trace your steps to chiropractic. So you heard a voice. You heard a voice. You had a calling, basically, to get into chiropractic.
I did. I was doing massage for many years, and I had a really great practice, working with great people. But I was feeling like I wanted to do something more, maybe have a little bit more, I don't know if responsibility is the word, but something with a little bit more to it than what massage was giving to me. Okay. Although, God, I love doing massage. So I thought, well, there's Chinese medicine, acupuncture, herbs, and all of that, or chiropractic. Those are the two.
Okay.
And I was like, what do I do? What do I do? What do I do? And one day, I was at a crosswalk in downtown San Francisco.
You have really great life metaphors, right? So
yeah.
Your passion is getting people into alignment, and then you were at a crosswalk is where you made a decision.
No. I never thought of that, but it's true. You're right. Yeah, so I was at the crosswalk, and, watching the lights blinky and, the beep, beep, beep and all that. And as I'm listening, watching, I just stopped. And it was like, okay, this is what I heard. Chiropractic wouldn't be bad. I mean, okay, as far as like prophetic voices go, that may not be like the deepest soul kind of voice, but that's what I heard. And I thought, okay, let's check it out.
Okay.
And it turned out to be a really good thing for me. So I was very happy.
So when you go into chiropractic school, do you choose like the form you're going to use, or do you learn different ones in school and then you pick that? So people watching may not know that there's 62 different types of chiropractic?
There's so many. In our school, it was really wonderful because there are a lot of techniques that we were trained in as part of our education. I don't even know how many there are. I would hazard to say there may be 100 or more different kinds of techniques. Okay. And it seems like the art part of chiropractic, the individual practitioner brings to their practice a part of themselves. Okay. So each person is going to have a little bit different way of expressing what they do. Yeah. One of the things that, was emphasized in the school that I graduated from was that chiropractic is a philosophy, art, and a science, which I really like that a lot. You need the science for sure, and I'm a very science-oriented person. I want to look at the results. I want it to be, calculable. I want it to be qualified, quantified, all that good stuff, and reproducible results. Yeah. But I also think that, you're doing something with your hands, unless you're doing a technique that has, other equipment or methods. But it's an art form, too. You bring to it your own creativity and your own approach physically.
Well, there's got to be a lot of intuition as well.
Absolutely.
Just being tuned into the body.
Yeah. And I know and respect and have had adjustments from chiropractors who don't work that way, that they're very much, this is how you do it, this is the way it's done, you have to follow this protocol this time, every time. And I've had great results, on me. I've tried a lot of different things. But for my personal satisfaction, I really have to feel the heart of it, or else I don't enjoy doing it. I don't want to spend my precious energy doing something I don't really love. Okay. So that's kind of the way I approach it. Is a lot of art you know.
I appreciate that approach in a healthcare provider, right? Instead of like, I'm going to follow this rote manual step by step, and I'm not going to treat each person as an individual. Like, I really appreciate that holistic approach, treating the whole person, and they're not just, you know, they're not just the bones of their spine, right? They're everything that's going on with them. And
you look at the whole person. You know, you're not the shoulder that hurts that come into my office. I will address your shoulder, obviously, but I'm going to look at you globally too. It's like, what's affecting what else? And there isn't any one part of us that is like a little island by itself. Everything works together. Like, I mean, you know, from your dietitian and nutrition education, that what you eat doesn't just go to the stomach and do its thing. You know, it's like what you eat goes everywhere, which is why it's so important to have good nutrition, because it fuels every cell, not just a few cells. And I feel that way about even something like chiropractic. I may be adjusting your spine, but I know that the ripple effect, like dropping a pebble into a placid pond, it's going to go out and out and out and out, and it's going to affect all of you. And that's how I like to approach it as well.
Yeah. Well, and I want to ask you about chiropractic philosophy in general, but before that, I want to go back just a little bit for a little bit of history lesson. So a lot of people don't even understand. They just think like chiropractic is some kind of an alternative healthcare provider that just, they don't even know where it came from. But people don't realize that actually there were medical doctors back in, I don't know, 1600s, 1800s, where they started disagreeing on how they wanted to treat the human body, right? And then that branched off these different types of medicine then. And in the United States, we have this predominantly allopathic paradigm where everybody thinks that's what a doctor is, but all these other types of doctors branched off from that, like chiropractic, doctors of osteopathy, there we go, and homeopathy, naturopathy, there's probably some other ones.
I'm sure there are. But yeah, even farther back, in like ancient Greece, I think that's when it started, where with Western philosophy, where the body, the mind, the heart at one time was considered one whole being. And then with the development of Western thought, it started to separate, where you had mind and body as separate entities, that they were not one conjoined energy form that was embodied in a person, but that you deal with the mind here, you deal with the body here, you deal with the emotions here, you deal with the spirit there, and they don't mingle. And I think that was the start of allopathic philosophy, and it is a philosophy just like natural or holistic philosophy. It's a way of approaching the body and the health of the body. I personally think that you cannot separate them, that you have one being, and that includes your body, your mind, your spirit, your soul. Anything else you can compartmentalize us as they're just constructs of our mind. They're not real.
Right.
What you do in your physical life is going to show up in your emotional life, in your mental life, in your work life, your personal life, period. You have a life, period. So that's my philosophy of the body, mind, spirit, and all that. But in 1895 is when Chiropractic was founded by D.D. Palmer, who he was kind of an interesting guy. He started out as a magnetic healer, like really alternative. And that's also when Western medicine in the States anyway started out also. Like MDs have their roots about the same time. And they were very divergent paths, to be sure, but they started out the same. And to be fair, medicine in the 1800s wasn't all that great either. There was a lot of interesting facts.
Well, you just give a little morphine syrup to your baby and that cures all its ills. So.
I'm saying, so it's a matter of development and evolution, I think, for both fields. And I think chiropractic has a little bit of a split personality in a way. There are some doctors that feel you really have to follow the old paradigm that D.D. Palmer and his son B.J. Palmer also promoted chiropractic after his father. They didn't get along too well, but they both are instrumental in the field of chiropractic. And if you are very traditional and you really go with that philosophical point of view like D.D. Palmer had, you don't do anything else but adjust the spine, period. Okay. And if I get this wrong, fellow chiropractic colleagues, forgiveness is wonderful.
Let us know in the comments.
Yeah. This is how I understand it to be.
Yeah.
All right. So the other personality of chiropractic is more science-based, similar to maybe medical profession as we know it in our Western world, where you really want to see evidence-based results, and you want to make sure that the mode and function and how you practice chiropractic is in line with modern science and what we've discovered today about health and well-being, physiology, all of that, neuropsychology, everything. I'm happy not being one or the other only. I really love some of the traditional philosophies, that vitalistic way of looking at life. Energy within us is so powerful. It's like we don't have to think about, oh my gosh, let me make sure my heart is beating. Is my kidney functioning properly? Is my liver doing what it should? We don't have to do that. There is, and the catch term, I guess, would be innate intelligence, is what a lot of traditional chiropractors might use. That innate intelligence is within us. It keeps us going. But, I really don't think chiropractic is the cure-all to everything, although I've seen some miracles.
Okay.
I really have.
Okay.
But there has to be common sense with some of this too, on both sides of the fence.
Yeah.
Okay. So I'm not like science only, and if I can't prove it in this double-blind trial, then it doesn't exist.
Right.
I don't feel that way either, because I've had enough clinical evidence to show me otherwise. But kind of having a little moderate point of view where you look at the beauty and the truth of both sides of the issue.
Yeah, I can really appreciate that. I'm sure it's very effective then. And so talk to us about the philosophy of chiropractic in general, about how aligning the spine affects so many other things in the body. Like most people would just think like, well, if my back hurts, I might go to the chiropractor, or, probably a lot of people have experienced like that was out of alignment and they popped it and now I feel better. But talk to us more about like what's going on in the spine and why does it affect the whole body?
Sure. Okay. The central nervous system is housed in our skull and in our spine. Bones come around and like this, and the little bumpy parts you feel on your back, that is part of your vertebra. And it's coming around like this, and there's a hole in the middle, and that's where your spinal cord goes through. It's housed by your spine, by your spinal column. So I call it the brainal cord.
Okay.
It's made up of the same material as your brain is made up of. It's part of your central nervous system. So when your vertebrae are not functioning properly, maybe they're misaligned, maybe there's soft tissue restrictions like tendons, ligaments, muscles, fascia, it's not allowing that joint to function the way it's supposed to function.
Right.
That's going to cause a restriction in that area. So that means that portion of your spinal column or spinal cord, where nerve roots come out and supplies your body to do its thing, because that's the only way it works, is not going to be functioning as well either. It isn't that you're going to be paralyzed or you're going to die, although if it's severe enough, both will happen. Right. But garden variety, like my back hurts and I'm going to get an adjustment and then I'm going to feel better, that kind of thing we're talking about. When you release that tension, the spinal cord tension also releases. Cerebrospinal fluid flows better. Your nerve impulses happen more freely. You have more freedom of movement. Your muscles can let go of their tension. And then everything just feels better, works better, functions better, and you activate better health. But it's not always directly like, okay, I'm going to adjust your mid-back area where the nerve root goes to your heart. It doesn't mean that by adjusting that, now I'm going to do some kind of magic on your heart, okay? I may, it may happen, but that's not really what I mean. I may adjust that part of your, upper mid-back, and indirectly, things are going to work better, and that may ultimately improve your heart function. I have had patients, multiple patients, who've come into my practice who had high blood pressure, and after chiropractic care for, I guess the quickest I saw results was about a month, but certainly within about 3 months, changes started to happen. This is anecdotal, okay? I didn't do a study, but a lot of clinical information out there that is worth looking at.
Right.
And maybe doing a study sometime.
Well, the clinical information, like, you've probably seen thousands of patients, and that teaches you a lot about what helps get people better. And I mean, one of the difficult things about these double-blind, placebo-controlled is that you have to find people that are almost exactly the same to run these trials on, and that everybody's a unique person, and there's a lot of different things going on, and so it makes it really hard to replicate, Joe Schmo that comes in and you help his blood pressure, then to find somebody else that's exactly like that and then not treat him.
Yeah, and that's why you need big numbers when you're doing studies like that. You need a big cohort group.
Right.
Otherwise, it's interesting information and worth looking at, but it may not be like, wow, this is really significant. Although there are studies that are very significant about low back pain, as you said. That's like one of the number one things that brings people to a doctor or a chiropractor or some alternative care provider is low back pain. And there have been studies that have been done that have been reproduced and had a huge cohort group that clearly determined that chiropractic care for low back pain is the treatment of choice.
Okay.
Because it's non-invasive. Because sometimes you do need surgery, but oh my God, I would want that to be my last option. And I would venture to say most orthopedic surgeons would agree with me that you don't want to just jump on it and do surgery. You want to make sure that you have less invasive kind of procedures that you've tried that make sense.
Yeah. Well, so you mentioned low back pain as being, a valid disease, not really a disease, condition, there we go, that chiropractic is great for. What are some other things that you see clinically that are kind of like maybe the top 5 or 10 things that you're like, oh yeah, that gets a lot better with chiropractic?
Migraine headaches.
Okay.
Headaches in general, neck pain, mid-back pain, low back pain, obviously. Like shoulder issues, knee, hip, all of that. Especially, we are a very active society now. Even as we get older, people are doing more, they're doing sports, they're running, they're jogging, they're hiking, they're biking, especially around here. Oh my goodness, this is like outdoor world. So there's a lot that can go wrong.
Yeah.
I mean, a lot can go right, but sometimes, weekend warrior stuff, or you have an injury or something happens, things like that, chiropractic helps very well.
Okay.
Yeah, and it depends on the chiropractor also, how you practice.
Yeah. Do you see children and infants in your practice?
I do.
So I've heard some stories from people that have had some pretty amazing results with very young babies. Have you seen that? Tell us about some of the things that can happen with little babies.
I was very lucky, blessed, fortunate to have in my practice so far 4 women who got pregnant during care that I took care of them throughout their whole pregnancy and was able to assist at the birth of their children.
Oh, wow.
I know, it was so amazing. I can't even put into words what that was like. But I was also fortunate enough to adjust their baby within 1 or 2 hours of their birth and take care of the mom. And when I say adjust that newborn, I'm not talking, popping, snapping,
yeah, it's
cracking.
not the stereotypical.
I'm talking with my little pinky fingers, just, giving very, very gentle, light pressure to help align their neck. When a baby's born, it's not a graceful, gentle process. And those of us who've given birth and were awake to see it, it is not for sissies. So when that baby comes through the birth canal, if you have, a natural delivery like that, there's a lot of twisting and torquing to get through, because it's a small space that baby has to get through, which is why the cranial bones aren't fused until later. And we can talk about how they don't actually fuse all the way either. But so it's a harsh process in some ways, and they're very resilient, and they heal quickly, and all the different contortions resolve quickly. But with that very gentle chiropractic adjustment at that young age, it's like phenomenal the way it can change the length of time, how they nurse, especially if there's any issues of colic or any of the common things that happen with newborns. Really makes a difference. And as far as infants, I've had parents, ready to pull their hair out, coming in with the baby who is so fussy. And I just do infant adjusting is very gentle. It's like with fingers. We're not talking grabbing their heads or anything like that. I'm amazed at the images people have when they hear that I adjust babies or anything. It's like, no, we don't do that. I might use just my pinkies or just my index finger or just like this to very gently realign. And just with one touch in the right place at the right time. I've had babies who are literally like almost climbing out of their mommy's arms crying, and I do it, and like this, they just stop, and they're like, and they're laughing.
Finally, somebody
smiling.
Fixed that spot that was hurting in my back.
And the mom is ready to cry, tears of joy, because I don't know how fussy your baby was, but
as long as I was holding him, he didn't cry at all.
You are very fortunate.
Well, I mean, I had to hold him all the time.
But, if the baby is uncomfortable for whatever reason and you can't figure out what it is, and it's something that can be easily remedied, and it's non-invasive, it's gentle, it's safe, it's like, gosh, why not? Wouldn't you want to?
Yeah, well, and those were the stories that I'd heard then recently where, maybe it's their first baby or their second baby that is just screaming and crying and won't sleep through the night, and they're ready to pull their hair out, and like you said, just that really gentle adjustment, and it's just life-changing for the parents, but can imagine for the baby too as well, because there's a reason they're crying and fussing, and when you can relieve that, they just feel so much better. So that's one of my favorite applications of chiropractic is because a lot of moms suffer with postpartum depression when their baby won't sleep, and it's frustrating as a mom because it makes you feel like, what am I doing wrong? I'm not a good mom, and
the sleep deprivation alone is enough, and if your baby can relax more, rest more, sleep more, that's like paradise. I speak from experience. My baby did not sleep well, so I was like very glad I knew what to do to help, and even with the best of help, sometimes your baby could be very fussy and have issues that you can't discern right away, and they can't tell you. So, you have to sometimes try different things to see what works for them.
Well, and I imagine it's easier to treat somebody else's child because you're not as biased as with your own, right?
That's true. It's very true. That's why they say, don't treat your own family. Although I do in emergencies, but it is a little bit more challenging, I think, for all kinds of reasons. But And I guess I've treated from an hour old, and my oldest patient ever was 90.
Okay.
Yeah, or a little more than 90. I could never quite tell. I know it was 90 or above. They wouldn't quite say how much above.
Okay. Yeah, well, really cool stories. Let's see. So now I want to know about how did you get on this keto lifestyle? Because you've been doing it, you shared with me that since the 90s.
Yes.
It wasn't even very well
wasn't
known
on the
or
radar.
popular. Yeah.
And, it wasn't like mainstream yet when I found out about it. And I was in chiropractic school, and this was in, I guess, 1991, 1992. And one of my professors was doing the Atkins diet.
Okay.
That was the big thing back then, I guess.
Yeah.
And he said that he was eating all this bacon, all this, cheese and fats, and and at that point I was about to, my jaw dropped, because I thought, oh my God, you're going to have a heart attack.
Yeah, you're going to drop dead.
And I'm going to have to do CPR on you while we're in class.
Was his primary motivation weight loss? Is that?
Yes.
Because that's pretty much the only reason why people did Atkins back then.
Yeah, it was weight loss, and he was pre-diabetic or borderline diabetic.
Okay.
And so he had done low fat, high carb, and that didn't work for him. And he tried all different kinds of diets, and there are so many fad diets that have been around since I don't know when.
Yeah.
And none of them worked for him, or he might have lost some weight, but then yo-yo back.
Okay.
And then he found out about very low carbohydrate, high fat kind of way of eating. And Atkins was the most well-known doctor doing it at the time. And he tried it, and it worked for him. He lost over 100 pounds.
Oh, wow. Did you see that, or was it he already
I saw
lost
him
it?
in process.
Okay.
He had already lost 100 pounds. And I was like,
oh,
wow.
Okay.
Because he just still had to lose about, I think at the time, maybe 50 more pounds to go, which he did in the course of my knowing him at the time as a student. And I was so intrigued, because I was indoctrinated in, that would kill you.
Yeah.
And that at the time it was eating not refined carbohydrates, certainly, but lots of whole grains, legumes, and lots of vegetables, and I guess like whole grain breads, pastas, things like that were all good too back then, and very low fat. Low fat to no fat almost, and to limit your cholesterol intake. All the things that have been part of that food pyramid that we've had for way too long. But it never agreed with me, but I ignored it all, because that's what was healthy. That's what you were supposed to do. And I was doing everything right, but I never felt quite right. And I never had a weight issue, but I wanted it to be for my health and well-being and longevity. And, I didn't want to grow old and be feeble. I wanted to grow old and be spry, doing jumping jacks at 90. So I really started to research, and I found out that for decades this had been a way of eating to help with some health conditions. And we had talked before about epilepsy, that this had been around since, like you said, the 20s, right?
Yeah, 20s or 30s,
Yeah, I think it was the 20s. They started doing a benign ketogenic diet, for epilepsy.
Yeah, unfortunately back then they didn't know about bad fats and good fats, so they were feeding people a lot of industrial seed oils like corn oil and things like that. But that's, we won't talk about that.
No, that could take a whole nother interview. But, so I started researching some of this, and I looked at the results, what Dr. Atkins was doing, and he, is an MD, and I believe he was a cardiologist, and the huge mountains of information, even in the 60s, but not even about the epilepsy, but around that time, like 50s and 60s, there was a huge push with the sugar industries to promote their product, obviously.
Did you watch that documentary called Sugar Coated?
Yes.
It's out on Netflix now.
Yeah, I've seen that. I highly recommend it. And, you know, there were really good studies that showed that a high-fat diet and even high cholesterol was not an indicator of cardiovascular disease or heart attacks or atherosclerosis or any of the things that we were like frightened about. And they had two sets of data, like what do you go with? Well, a lot of money from that sugar industry, which also supplied the refined foods industry. Like, I mean, go to your grocery store, and if you don't stay on the perimeter of your grocery store, almost everything in the middle is going to have sugar in it. So that industry funded so much of that research. And when your money is coming from this industry, I'm not saying that they were out and out lying, but it's really hard to not have that bias, I would think. So the research that talked about ketogenic diets being beneficial and having great benefits, and even the studies that showed epilepsy being almost completely neutralized by a ketogenic diet, where they did not need medication anymore and they had no more seizures in so many of the patients. That went by the wayside too for a time period because there were drugs that were developed to help with seizures, but they always have side effects. You know, so I'm so happy now that ketogenic way of eating is popular again. I've been like calling from the wilderness since the 90s about this.
Yeah, it's really too bad that, you know, Dr. Atkins' timing was unfortunate, because he was doing this work. He was working with people clinically, and he was seeing these health transformations, but he was up against this big lobbying effort that then started brainwashing us all and telling us that fat was bad. And so people were really afraid. And I even, you know, I've read several versions of his books, and his first book was all about, you know, butter and bacon, but then he even caved to some of that pressure, and you can find versions of his book that say that you should have margarine because that was supposed to be healthier. It was cholesterol free, and you know, not as much focus on these traditional fats, unfortunately. And then it very quickly evolved. A lot of people following an Atkins diet then, because they were afraid of fat, was that they ended up having a higher protein diet. And that's one of the biggest differences between what people think of as traditional Atkins diet and a ketogenic diet, is that the way most people eat an Atkins diet is that it's much higher in protein. Protein is kind of a free-for-all, whereas on a ketogenic diet, you need to moderate protein and maybe even keep it on the lower side. And then you've got to eat a lot of fat to make up for that. And
Atkins burns fat.
Yeah.
It does.
Atkins diet as well only keeps carbohydrates really low the first couple of weeks, and then it allows you some higher amounts there. And so an Atkins diet may or may not be ketogenic. And you could do, you know, you can do an Atkins style ketogenic diet. So there's some overlap, but they're not necessarily exactly the same. So
a lot of variations on the approach. And you know, the thing about protein is very true. You think, well, protein, it has no sugar. But if you eat too much protein, it gets converted to sugar. And you know, what gets converted to sugar either goes into a fat metabolic pathway or fat storage pathway. So if you have too much sugar in your system, you're either going to burn it up, you know, glucose, you're going to burn it up, or you're going to store it. And that's what, you know, stored makes you fat.
And there's a lot of controversy about, like, you know, it takes, you know, 300 grams of protein to cause gluconeogenesis, which you're talking about. But it's very clear, especially in people that are insulin resistant, that too much protein, especially at one meal or even at one meal, can cause a rise in insulin, and whenever you get a rise in insulin, you get a decrease in ketosis. And so I've seen, especially people that are that were pre-diabetic or they were type 2 diabetic when they started a ketogenic diet, they tend to be very sensitive to protein. Somewhere around 30 or so grams per meal tends to be about the max tolerance. It doesn't affect ketosis. So.
And you have to also think about your activity level. I mean, are you an elite athlete or a couch potato or something in between the two? You're going to have to use some common sense. I mean, you can't just put the food in, do nothing, and expect to lose weight. I mean, that's not going to happen quite that way. Yeah. Although, having said that, I have to say, eating in a way that is ketogenic, you don't get so hungry. The satisfaction, the satiety that you feel is so much greater than when you're on a high carb way of eating. That for me personally, sometimes I have to make myself eat more because I'm just not hungry. Right. But I know I'm going to have a really busy day, or I'm going to have to push real hard, so I will eat a little bit more. And everybody has a different carbohydrate tolerance. In my family, my husband and my son, they can eat just the teeniest bit of carbohydrate, and it will put weight on them. Okay. I'm sorry, because carbohydrates are pretty fun to eat, but not good for you if if you can't tolerate it and you become carbohydrate intolerant, which is kind of like saying insulin intolerant. Kind of works out the same way. For me, I have to eat a little bit more carbohydrate than most people on a ketogenic diet because of my metabolism. If I don't, I kind of shake apart. I need a little bit more. So you really have to pay attention to your own body and your own needs. But generally speaking, I stay around 50 to 60 grams of carbs a day if I can. Yeah, which is
that's still probably
too bad for me.
A quarter of what most people in the United States are eating.
Yeah. And for like my husband, he needs to stay like 25 or below to keep the weight down. So I can eat twice as many carbs, which I try not to do at home. I do it when I'm away.
That's a good family dynamic. Support each other.
Yes, absolutely. Absolutely.
Well, and that illustrates a point, that a lot of people complain of, like, well, my husband can eat whatever he wants, or it's usually not the wife that gets to eat whatever they want. For some reason, it's usually the husband. But we're all unique individuals. Yes. We've got to figure out what works for us and what makes us feel the best. So.
Absolutely.
Well, in closing, I have a question for you.
Sure.
If you knew today was your last day on Earth, what would you eat?
Well, you know what? I ate it last night.
Okay.
I worked yesterday, and I came home, and my husband had so much of it already done. It was like, love this man. It's marinated beef, Korean style, kind of like teriyaki, but without the sugar in the teriyaki sauce. You don't need the sugar. Absolutely don't need the sugar. Grilled, and lots of vegetables. I did spinach Korean style, which is just like wilted. It's not boiled until it's mush. And a cucumber salad, which is also just deliciously flavored Korean style, and little steamed rice. But I got to tell you, I discovered something new about starch rice, because I'm Korean. I have to have rice. I'm sorry. But you can do it in a way that makes it carbohydrate or starch resistant starch. I don't know if you've heard about this. It's the way you cook the rice.
Refrigerate it.
Yeah, you have to cook it with fat. Fat. Yeah. Right? So for every half cup of rice, you need a lipid. Like sometimes we use coconut oil, sometimes avocado oil, because there's no flavoring really with avocado oil, so it doesn't taste like coconut rice, which is great though if you're having Thai food or Indian food. So half cup rice, teaspoon of oil, cook it like normal, and then you have to refrigerate it about 12 hours. You can reheat it, and it doesn't affect the efficacy of that starch reduction. So that's how we cook rice now. So that would be my last meal.
Wow.
Yummy.
And you just had it last night. That's awesome.
Just had it last night.
Yeah. Well, that's really, really cool. And I just wanted to add one little bit too, that the research does show that people of Asian lineage, that you have more genes that code for carbohydrate digestion, and so you're the first person I've interviewed that follows a ketogenic diet, and I'm really curious then to see you have reported that your carb tolerance is higher and that you feel better on that.
I do.
Could be your gene expression,
Yeah, it
and
might be.
Yeah, so that's That's really cool. Thanks for
But, you know,
sharing.
the amount of rice I eat is a lot smaller than I used to growing up. But, you know, girl's got to have her rice.
Well, thank you so much,
You're
Dr.
so
Paula,
welcome.
for being here and sharing your story with us. And if you like this video, give us a thumbs up and subscribe if you want to see more. And thanks for watching. Bye.
Bye.